Hi, happy morning everyone. Welcome to Metier YouTube channel. I hope you're all fine and preparing well for the RRB exams, and congratulations who are selected in NORCET prelims exams and preparing for the main exams. And I'm proud to say that our Metier Academy students, more than 450 members have passed the prelims, and congratulations to them. And please prepare the main exams because very less times are there. So kindly go through our classes regularly so that you will get to know about the question patterns and how to appear for the main exams. Okay, so you all know that in Meteor YouTube channel, we are uploading very important topics and important MCQs for the nursing competitive exams. So today also we are going to see on important MCQs which related to the RRB as well as for the NORCET. Okay. Who are all not subscribed our channel, please kindly subscribe and please support us. So today's session, we will start with a small quote. We are kept from our goal not by obstacles, but by a clear path to a lesser goal. So that means we are not struggling with the obstacles. Nothing is stopping us. What is stopping from achieving the goals? We are not setting the goals. So before your progression, before starting any kind of an exam preparation, set a goal. Either it's a bigger goal or a smaller goal. Set a goal and then prepare yourself to achieve that goal. So the clear path is already is there, but your clear goal is needed to achieve something bigger in your life. So தடைகள் எதனால இருக்குன்னா தடைகள் வந்து அதிகமா இருக்காது. நம்ம வந்து கோலை கரெக்டா செட் பண்ணலாம். கோலை கரெக்டாக செட் பண்ணுங்க. எந்த தடையாக இருந்தாலும் நம்ம வந்து தாண்டிட்டு போயிடலாம். ஓகே, ஸோ ப்ளீஸ் செட் அ கோல் அண்ட் தென் ப்ரிப்பேர். ஓகே, today we are going to see about phobias. Very important topics. Phobias, you all know that it's an anxiety disorder, right? It's an anxiety disorder. Irrational fear to the object, situation, people, place, right? So that is called phobia. So first question, a nurse is educating a patient about phobias. Which of the following statements accurately describe the specific phobias? We have mainly three categories of phobias. Generally, we will divide the phobias into three types. Social phobia, specific phobia, and agoraphobia, right? So here the question is about specific phobias. So what is the statement which gives the correct statement about the specific phobias? Option: specific phobias are fears of a particular stimulus that trigger excessive unreasonable response. A specific phobias are fear of being judged, criticized, or embarrassed in a social or performance situations. Specific phobias are fear of being in a place or situation from which escape might be difficult or embarrassing. Option D, specific phobias are fear of a particular object, situation, or activity that poses little or no actual danger. So what is the correct option? The correct option is option A. That is, specific phobias are fear of a particular stimulus that trigger an excessive unreasonable response. What will happen? I'm a phobia patient. I'm going to a specific, I'm having the fear of a particular object. I'm seeing that objects irrationally, excessive amount of response will be stimulated in my body. Why it's happening? The phobias are related to the excessive stimulation of our autonomic nervous system that leads to sweating, palpitation, increased heart rate. So many things will happen in the body during the phobias, right? So specific phobia is particular trigger, objects, okay, or a situation. That is called a specific phobia. What is social phobia? A fear of embarrassing oneself in a social situation, like while speaking in the stage or eating in front of others and toileting in the public. So those are the social phobias. So option B is telling about the social phobias, right? Okay. What about option C? Specific phobias are being in place or situation? No. The option C is telling about agoraphobia, fear of the places. Example, fear of a marketplace, right? So that is option C is about agoraphobia. Option A is specific phobia. Option B is social phobia. Option C is agoraphobia. What is option D? A fear of a particular objects that poses little or no actual danger. It is common. That is fear. That is fear is a common factor for the everybody will face, right? So that is option D, right? So according to the first question, the option A is a right answer. Okay. Next question. A nurse is providing education to a client diagnosed with a specific phobia. Which medication class should the nurse include in a teaching plan? Options: antidepressants, benzodiazepines, beta blockers, and analgesics. So the correct option is option C, beta blockers. So don't think that phobia is related to the psychiatric condition, so that we need to give an antidepressant or a benzodiazepine. Yes, antidepressant we will provide, and benzodiazepine also we will provide. But it is not a drug of choice which is treat the symptoms of a phobia. So what are the symptoms? You know that the patient may have, as I said, increased heart rate, anxiety, trembling, right? Sweating because of the autonomic nervous system stimulation. So we need to provide a beta blockers to manage the physical symptoms of a specific phobia. Clear? Yes. Yes, we can give the benzodiazepine also for acute anxiety symptom, but it's not actual management for the symptoms of the phobia. So analgesic option D is not useful, which reduce the phobic symptoms, right? Analgesic for the pain management, right? So next question. A fear of darkness is called what? Fear of darkness. Ichomophobia, aclophobia, amaxophobia, anthropophobia. Once again, I'm reading the question. Fear of darkness is called what? Ichomophobia, aclophobia, amaxophobia, anthropophobia. So the correct option is option B, aclophobia. Aclophobia is fear of darkness. Everybody is having the fear of darkness, but these people have too much response to the darkness. Sometimes if the group of peoples are there in the darkness, we won't feel fear. But these people, even 100 peoples are around them in the darkness, they will fear irrational fear. Too much of fear in the darkness, right? So that is aclophobia, fear of darkness. What is A? Option A, achomophobia. Achomophobia is nothing but a fear of sharp objects. Not only knife, needles, anything which is sharp, they will get a fear. Okay? Even a paper, sharp paper also, they will get a fear. That is icho or ichomophobia. Okay? Ichomophobia. Next is option C, amaxophobia. It is fear of driving a vehicle. Okay? Fear of driving a vehicle, either a car or either a truck or either a scooter. Not only driving, fear of driving, it also being inside while driving. Either you may be a driver, that patient may be a driver or a passenger. Okay, that is amaxophobia, fear of driving or fear of fear of a patient, fear of a person inside the vehicle. That is amaxophobia. So what is option D? Anthropophobia. Anthro means human beings, right? Fear of people. These people will not attach to the persons because of the fear of the people. That is anthropophobia. Right? Yes. So fear of darkness is ichomophobia, fear of sharpness, aclophobia, amaxophobia, fear of a passenger or a fear of driving a vehicle, anthropophobia, fear of people. Okay, next question. Atychiophobia. Atychiophobia terms indicates what? Atychiophobia or atychiphobia. Options: fear of imperfection, fear of failure, fear of crossing the road, fear of opinions. What is meant by atychiophobia? Option B, fear of failure. These persons, that atychipophobia is what? They think that whatever they do, that will end up in the failure mode. So that is fear of failure, atychipophobia. What is fear of imperfection? That is atelophobia, fear of imperfection. So, for example, one woman, she is so beautiful, but still she, while seeing the mirror or going to the particular situations or a place, that she think that others are beautiful than her. She is the beautiful woman in the world, even though she thinks that she is imperfect. That is atelophobia, fear of imperfection. What is fear of crossing the road? The terminology is called agyrophobia. Agyrophobia, the fear of crossing the streets, crossing the road. That is agyrophobia. What is fear of opinions? That is allodoxaphobia. Allodoxaphobia. In the adolescent age, nobody wants to hear the opinions, right? Nowadays also, we don't want to hear opinions from the others. But these peoples will have a too much response to the opinions, right? So that is called allodoxophobia, fear of opinion. Clear? Yes. Next, fear of gold, right? Fear of gold. Nowadays, everybody is fear of gold because of the rate. So that is not the thing. Here, a psychiatric problem. Fear of gold is called what? Options: orophobia, ataxophobia, athesogoraphobia, a athasogoraphobia. Athasogoraphobia. Next, autophobia. So what is the correct option? Fear of gold is option A, orophobia. These people, while seeing or talking about the gold also, they will get a fear. That is called orophobia. What is ataxophobia? These people are perfectionists. Their fear of disorderliness and untidiness. Whenever they see the things or a room which is unorganized or untidiness, they will get a fear, right? So these people, they want everything will be organized, everything will be tidy, right? So whenever they seeing that room or a place which has untidiness, they will get a fear, right? Okay, that is atoxophobia. Next is athasogoraphobia. What is athasogoraphobia? Fear of being forgotten. People think that if I'm going to somewhere, these people are here, they will forget me, right? So that is fear of forgotten. So they think that they will be forgotten by this close relative or friends or lovable persons. That is athasogoraphobia. Okay, next is autophobia. What is autophobia? Yeah, fear of being alone. They don't want to be alone. Whenever they are alone, they think that they are more feared or more phobic, become more phobic. That is autophobia, right? Yes. So that's all about today's session. I hope the class was, for some persons, it is new for them. Whoever liked the class, please press like buttons. If you have any doubts, please comment it in the comment section or a comment box. Please subscribe our channel. Then we will upload more and more videos for any updates regarding the exams also. We will put it through this video. Thank you all. Thank you so much. I'll meet you in the next session.